Here are three big changes that are going to affect seniors in 2025. You don't want to miss this. I have a whole list ready to talk to you about. These are important issues that you need to pay attention to because almost 40% of seniors are going back to work due to low cost of living adjustment for Social Security. I'm going to walk you through a story of one baby boomer making $1,470 in monthly Social Security benefits that had to return to work. I'm going to share her story with you and why you should pay attention to what's happening with her situation. And then I'm going to talk about the three big changes that are really driving this issue of seniors going back to work because they face economic challenges. And I want you to stay till the end of this video because I have 20 financial assistance that every low-income senior needs to know right now. They are programs that you need to be using, but are probably not using because you just simply did not know about them. So I'm going to bring it all up to you. Now, if you're new to this channel, please hit the subscribe button. All we do here is bring you the latest news and updates on things affecting your Social Security benefits, food stamps, Medicare, Medicaid, and other benefit programs that seniors depend on. So, if you're new here, hit the subscribe button, hit the like button. Let's get started. So, why are seniors returning to work in record numbers? Well, I have compiled a few articles that talk about this phenomenon that is happening that needs to be paid attention to, and it's actually very concerning. 40% of seniors are going back to work due to low cost of living adjustment. Social Security benefits amount adjust for inflation every year, but the small cost of living adjustment for 2024 might not be enough for most seniors, new surveys show. That is from Kiplinger. And then we go to the National Council on Aging, addressing the nation's retirement crisis. Today, 65-year-old can expect to live 20 years, according to the Social Security Administration. 80% of households with adults older, or 47 million of such households, are financially struggling today or at risk of falling into economic insecurity as they age. So they're suggesting optimizing Social Security benefits. This is from T. Rowe Price, the asset manager, on retiring, why recent retirees want to go back to work. Millions of retirees have returned to work in search of financial and emotional benefits. And then this is from Newsweek. All of this in 2024 and some of it very recent. Half of retirees are considering returning to work after COLA update. And then retirees are returning to work in droves. Here's why. This is another article from a local TV station in Cincinnati, I believe, and it's talking about many retirees in their 60s and 70s are returning to work. And they want to tell you why and what you need to know before you do. Next, I have to go to the New York Times. They ran a story in 2022 when this phenomenon began, and the title says it all. I had to go back to work. Over 55 and not retired after all. After leaving the workforce in unusual numbers early in the pandemic, Americans approaching retirement are back on the job at various levels. Then Resume Builder says 1 in 8 retirees plan to go back to work in 2025, and they took a deeper dive in what's happening. Why are people returning back to work? Well, 13% of retired seniors say they are likely to start working again next year. Top reason for retirees returning to work is increased cost of living. 22% of seniors are currently working. 38% of working seniors don't plan to retire for 5 more years. Let that sink in. 38% of working seniors don't plan to retire for 5 more years. And then 4 in 10 working seniors were once retired. It means that for every 10 seniors right now that are working, 4 of them were once retired and had to go back to work. And it says a lot of them for financial reasons. So Resume Builder did a deeper dive and have some numbers that we can look at that paints a picture of what's going on. 68% go back to work because of cost of living increased more than they expected. Why seniors are considering going back to work next year? 68% is because of cost of living changes. And then another 42% to combat boredom. But then look again. another 38% to afford rising housing costs, and then another 35% to help pay debt other than medical debt, and then finally another 8% to pay medical debt. So if you look at the economic issues, there's social issues, but there's a ton of economic issues where 68% are going because of cost of living increase, and then another 38% to afford rising housing costs, and then you have people going because they're in debt, 35%, and they want to be able to pay down their debt, which is not medical debt. So that paints a picture of what's happening. And one person's story I'm going to share with you, a baby boomer from Business Insider has this story digging deeper into this phenomenon. This was just published November 26, 2024, less than a month old. A baby boomer living on $1,470 in Social Security returned to work to support her children and grandchildren. And here is her story. Pamela Shields, unretired, to supplement her Social Security. Many older Americans say monthly Social Security checks aren't enough. An analysis found that 13% of retired baby boomers on LinkedIn returned to work in 2023. So what is Pamela's story? Well, let's dig into it. So she exemplifies a growing trend of unretired Americans at age 67 challenging traditional retirement expectations. Her monthly Social Security is $1,470, falls short of covering her basic living expenses. She lives in Fort Worth, and she represents millions who are facing similar situations. She has to get multiple part-time jobs to be able to survive. So let's dig deeper into her story. Her daily grind at 67 years old, nightly shift work at a grocery store, requires physical stamina despite related age-related challenges. Then she provides caregiving to elderly neighbors to create another stream of income. Her combined part-time work generates a monthly $600 in supplemental income. She works 7 days a week and is taking a physical toll on her through ongoing food pains during shift, which is highlighting health concerns. So how did she get here? She built a solid foundation through her career in customer service and human resources, responsibly established 401k savings, so she did all the right things. Then she had a financial setback with 2 divorces, reducing her income or her savings. And then she had unexpected medical expenses that drained the remaining resources. Her career was cut short by a devastating car crash injuries, forcing her to retire at 59. And now her well-planned life is pretty much falling apart, and a lot of people find themselves in this situation. So what did she do? Well, now she provides ongoing financial assistance to her adult children despite her own limited resources, and a lot of seniors find themselves in this situation. Houses and supports daughter dealing with chronic health issues, and she contributes to her grandson's education through marching band fee assistance. Regular grocery assistance to family members strains her fixed income, and she manages personal expenses including housing, utilities, and communication costs. And she's an example of what they call the sandwich generation, supporting their own children and then supporting elderly parents. So America's retirement crisis. Research reveals that 20% of Americans over 50 have zero retirement savings. LinkedIn data shows that 13% rise in unretired baby boomers returning to the workforce. Social Security benefits increasingly inadequate for basic living expenses, which is true. Growing trend of seniors forced to choose between retirement and survival. Economic pressure forcing lifestyle changes to adjust for this new retirement. Medicare provides essential but incomplete healthcare coverage. Early retirement at 50 meant that she got less Social Security. Then her combined monthly income is $2,070 from the $1,470 and the $600 she's making in those 2 jobs that she has. So continued employment is going to be necessary for the foreseeable future for her to be able to make ends meet. So critical life lessons. Early financial planning is crucial. Essential needs for comprehensive financial education starting in childhood is important. Life's unexpected challenges can quickly deplete retirement savings. Medical expenses remain a major threat to retirement. Social security system may require supplemental income sources. So you cannot just depend on Social Security just in her case, because the average Social Security benefit is what? About $1,500? The importance of building multiple streams of income for retirement is going to be really, really critical going forward. So what are these three big changes that are affecting seniors that are causing them to return to work in droves? Well, the first one is the COLA. The cost of living adjustment for 2025 is 2.5%. So on average, a senior is going to get $49 increase from $1,927 to $1,976. So that 2.5% is affecting people on Social Security retirement benefits, survivor benefits, disability, and SSI. And this goes into effect in January, which is why a lot of seniors are looking at their paycheck, their Social Security checks, looking at their financial situation and realizing that they will have to take action and possibly return to work. So let's look in detail how much you're getting. If you're getting Social Security in 2024, the average benefit is $1,927. 2025 is going to go up by $49 to $1,976. If you're a couple, your benefits go from $3,014 to $3,089. And if you're on SSDI, it goes from $1,542, the average benefit, to $1,580. If you're on SSI, it goes from $943, the maximum benefit, to $967, an increase of $24. And if you're on SSI as a couple, your maximum benefits goes from $1,415 to $1,450, an increase of $35. So the second reason is that you're only getting, on average, $49 increase in your Social Security benefits a month. And we're going to see from Medicare, your Medicare premiums go up to $185 a month, Part B. And there are a whole host of costs that have also gone up with Medicare. Medicare Part B deductible is projected to increase to $257. Medicare Part D out-of-pocket costs will be capped at $2,000 for covered drugs. And Medicare Part D deductible will increase to $590. And then the maximum allowable out-of-pocket cap for Medicare Advantage plans will increase to $9,350. So healthcare expenses are going to consume a lot of seniors' money. Meanwhile, the cost of living adjustment they're getting is 2.5%. So if you're looking for the reason why a lot of seniors are returning to work, you'll find it in these two slides: Medicare and Social Security increases. So what can you do about it? Well, I'm going to give you 20 financial assistance programs that a lot of seniors should be depending on, or at least looking into and getting help from, because it's available to you. But a lot of seniors have not been looking into these programs. So I've compiled 20 programs, and I have a surprise at the end. So stay tuned to the end of this video. So let's jump into it. The first one is the Seniors Community Service Employment Program. It provides job training and part-time employment for seniors. It focuses on community service roles, and it's for ages 55 with income less than 125% of the federal poverty level. It helps seniors stay active and earn income. So visit the website below for details. Next, we have tax relief for seniors. Includes federal elderly tax credit. State programs may offer relief on property, sales, or income taxes. Renters can also benefit in state-specific renter-focused tax assistance programs. And the programs can ease the financial burden of annual tax filings for seniors. So visit your state's tax office or consult with a tax advisor for details. Moving on. State Pharmaceutical Assistance Program helps cover medication costs, filling gaps left by Medicare. Available in several states with varying income limits, works alongside Medicare Part D. Visit state-specific SPAP website for eligibility or go to the website below for details. Next, free and discounted transportation program, non-emergency transportation to medical appointment and community centers. Programs like Access a Ride or Dial a Ride cater to low-income seniors, often funded through local transit agencies and senior centers. Eligibility varies. You need proof of age or income may be required. Visit your local agency on aging for more information. Section 202, supportive housing. Subsidized rental housing for seniors with low income includes on-site services as transportation and meals. Rent typically does not exceed 30% of the senior's income. And if you are 62 plus, you're eligible. If you have limited assets, you can apply through HUD-approved agencies or go to the website below for details. Next, we have low-income home energy assistance program. Pays for heating and cooling costs, reducing utility bills for seniors. They also offer weatherization services provided to improve home efficiency. Income limits, you cannot make more than 150% of the federal poverty level, and they offer crisis assistance for energy shutoffs and emergencies. This is a critical program. You don't want to lose your energy source. So if you're crushing or you're being crushed by utility bills, this is a program to look into. Many seniors on Social Security qualify. Silver Sneakers offers free fitness programs through Medicare Advantage plans, access to gyms, online classes, and wellness programs. It's focused on maintaining physical and health and reducing healthcare costs. Check eligibility with your Medicare provider or visit silversneakers.com. We have low-income internet called Lifeline. Offers discount on internet and phone. If you make less than 135% of the federal poverty level, you qualify. You can get up to $9.25 a month on your internet or phone bill. Focuses on digital inclusion for seniors. For more details, go to lifelinesupport.org. Next, we have state property tax relief. Offers tax exemptions, deferrals, or freezes specifically for senior homeowners. Helps reduce or delay property tax to protect homeowners. Eligibility varies by state, often requiring proof of age and income limits must be met, typically for 62 plus, and is focused on seniors remaining in their homes without financial strain. To contact your local tax authority or a tax expert for details. I have shown you this one from the state of Montana, Property Tax Assistance Program for people who need it, especially seniors in need. Number 10, Medicare Savings Programs. Assistance with Medicare premiums, deductibles, and coinsurance includes programs like the Qualified Medicare Beneficiary or QMB or the Specified Low-Income Medicare Beneficiaries or SLMB. Income eligibility, if you make less than 135% of the federal poverty level, you qualify. It saves seniors up to $1,600 annually in healthcare costs. This is a great program. Visit your local Medicaid office for details. Supplemental Security Income Energy Assistance. There are some seniors that are both on Social Security and SSI. If you're on both programs, you probably qualify for your state's energy assistance program, and you can combine with the low income heating energy assistance program and then get double savings on your energy bill. I have shown you one from the state of Ohio, but each state has their specific energy assistance program, and if you're on SSI benefits and Social Security, you may qualify for this in addition to the regular low-income heating and energy assistance program. Now, moving on, I have more, actually plenty more. Seniors Farmers Market Nutrition Program offers vouchers to purchase fresh fruits and vegetables, herbs, and honey accepted at farmers market, roadside stands, and community farms. You have to make less than 185% of the federal poverty level to qualify. Encourage access to healthy, locally sourced food. Visit the website below. This is a popular program. The one I'm showing you is from the state of North Carolina. And then there is the Commodity Supplemental Food Program. A lot of seniors don't know this. It provides monthly food boxes, including staples like grains, canned vegetables, and dairy. Aims to combat food insecurity among low-income seniors age 60 plus. Eligibility, you make 130% of the federal poverty level or less, you qualify, and the food is distributed and managed by local USDA agencies. Contact your local USDA office or visit the website below. Next, Social Security Supplemental Security Income. There's a lot of misinformation about this, but if you're a low-income senior and your Social Security benefits is really low, you may qualify for SSI. And about 25% of people on SSI are seniors over age 65. The maximum benefit is $967 if you're an individual, and if you're a couple, it's $1,450. And here's the thing. In some states, the state adds more money to your SSI money. So it is a good program to look into, especially if your Social Security check is very low. Moving on to reverse mortgages. So reverse mortgages, you need to proceed with caution because there's a lot of rules around it and you need to understand what you're getting yourself into. So basically, if you have a lot of equity in your house, you could get a loan that you don't have to pay back until your house is sold or vacated. And so if you are struggling to make ends meet and you have a ton of equity, you can get a reverse mortgage. And at the end, you can decide whether to sell the house or, vacate the house. And if you have plans to turn over the house to your children or your whoever you want to leave inheritance for, then you have to sort that out, because then you have to pay that loan back in order to keep your house. I am not an expert on reverse mortgages. I don't play one online, but I'm telling you, this is a program that has a lot of regulations around it. There are HUD-approved lenders that are qualified to do this. It's important to see one of them, let them explain everything to you so that you understand what you're getting into before you do this. It has saved a lot of seniors and have provided them cash that they need, but you also need to understand everything about this before you make that decision. Moving on, Meals on Wheels delivers nutritious meals to homebound seniors, prioritizes those unable to cook or shop due to mobility issues. Volunteer visits offer social interaction. So basically, not only are they delivering meals, but also have volunteers coming in, and it helps seniors that are lonely have some human interaction with wellness checks. And eligibility and fees vary by program. Visit mealsonwheelsamerica.org. Next, Housing Vouchers, Section 8, subsidizes rent for low-income seniors, ensuring they pay no more than 30% of their income on housing. Prioritizes seniors, disabled individuals, and families with children. You have to make less than 50% of the area median income to qualify. So this varies by location. And there's a long waiting list, obviously. So apply early and get more information at the address below. Aging and Disability Resource Centers. These are amazing centers that provide help for seniors to access resources. It connects seniors to local, state, and federal benefit resources. Services include care coordination, healthcare navigation, and housing assistance. Is designed for those who need long-term services and support, and they provide free consultations with trained staff that they have that understand these programs and can connect you based on your situation to the right program. So visit your local Aging and Disability Resource Center to get more information, or visit the website below for details. Number 19, Medicaid. Medicaid is healthcare for low-income individuals. A comprehensive healthcare coverage, including doctor visit, hospital stays, and nursing home care, covers in-home care and long-term care services for qualified seniors. You have to make less than 138% of the federal poverty level to qualify, and it varies by state. You can be dual eligible, where you may receive Medicare and Medicaid at the same time. You can apply online through Medicaid.gov. Food stamps. This is a topic I know a lot about, and I'm telling you, 50% of seniors that are eligible for food stamps don't apply. Sometimes because of stigma, because they are embarrassed, or because they simply don't know that they qualify, or they think that they're taking benefit away from somebody if they apply. You're not. Food stamps is one of the programs that anybody that is eligible and meets the requirements, including income, can get benefits. And you get it on your EBT card, and you can spend it on approved food items, healthy food items that you can buy at grocery stores, farmers markets, food stands, convenience stores, etc. Now, how do you qualify? Well, as a senior, there are special income limits for seniors and is higher. So the chances of you as a senior qualifying for food stamps are very high because the income limit is much higher. How much can you get? A lot of seniors say they only get $23. Well, that is true for some, but for most it's not. You can get more. The maximum one person can get for food stamps, if you qualify, is $292 a month. And if you're a household of two, it's $536. And here's the reason why you should apply. Some of you say you only get $23, and even if you got $23, there's a whole host of things that your EBT card allows you to qualify for. And for that reason alone, you should apply. And I also did a whole video about what you can do to get more food stamps. Because a lot of seniors are leaving deductions on the table. They are not reporting their income correctly. And so you are not getting the maximum benefit you're eligible for because you are not following all the rules to have everything that needs to be deducted from your income to give you the opportunity to get more food stamps benefit. Now, I talked about a surprise at the end. Well, I have 5 additional assistance programs that you should know about that I want to share with you. The first one is Dental Lifeline Network. It covers free comprehensive dental care for seniors with disabilities or low income. Seniors 65 plus or those with a permanent disability are eligible, and you must lack access to dental insurance. Services include cleanings, filings, dentures, and emergency dental work. You can apply online on their website as dentallifeline.org. Why does this matter? Because it helps seniors maintain oral health, which is critical for overall well-being. Next is Pets for the Elderly Foundation. This is a very popular one. It subsidizes pet adoption for fees for seniors 60 plus at participating shelters. Income guidelines may apply. Check with your local participating shelter. Includes pet food assistance and veterinary care in some locations. Visit the foundation's site for a list of shelters that participate in this program. Petsfortheelderly.org. Why does it matter? Companionship from pets reduces loneliness and improves seniors' mental health. I Can Connect is a national deaf and blind equipment program. It provides free technology like smartphones, computers, and braille display for seniors with vision or hearing impairments. You must meet their low-income guidelines and have documented hearing or vision loss. It includes training on how to use the equipment. You can apply through your state's I Can Connect program at icanconnect.org. Why does it matter? It improves communication and accessibility for isolated seniors. Next, we have Vision USA by American Optometric Association. It covers free basic eye exam and discounted glasses for low-income seniors. No vision insurance. If you have no vision insurance and your income is below their established threshold, then you qualify. Referral-based program available in most states. You can apply via their website at aoa.org. Why does it matter? Because they seek to prevent vision loss and promote independence for seniors. And then we have the Area Agency on Aging Pet Support Programs. It covers pet food, veterinary care, and grooming for senior pets on fixed income. Eligibility is typically tied to income-based qualification. Some agencies offer temporary pet fostering if seniors are hospitalized. So the one I'm showing you is from the state of Maryland. Contact your local area agency on aging to check availability. Why does this matter? Because it ensures seniors can afford to care for their beloved pets without financial strain. So, which of these programs are you going to look into? Did you know these programs existed? Did you know that all of them existed and were available to you? Have you tried using any of them? Are you currently using any of them? Or which one do you think you're going to try and explore? Because these programs can save you money. And I'm all about saving you money. So I hope this has been helpful to you. Let me know in the comment section below. If you're new to this channel, hit the subscribe button, hit the like button. And until I see you in the next video, thank you for watching.